Well, welcome back. This is Dr. O and the Dr. O Show here from Tallinn, Estonia. Right now we've got a case where we're just about to do a special procedure on a woman who is suffering with right lateral and medial epicondylitis, and she can't straighten out her arms. She's got weakness of all the muscles in her shoulder. This is the deltoid biceps, the flexor muscles of her forearm, the subscapularis, contraction of the middle scalene on the same side, causing a bit of a thoracic outlet compression going into that arm, and extensor carpi radialis brevis, also for the lateral epicondylitis, is very weak. The splenius and the trapezius muscles are contracted on the right. So we've got a lot of work to do. We're just looking at the x-ray right now. This humerus is too high. It's riding a bit high. And interestingly enough, she's a hairdresser, so what she does is she does this. Just show here what we're doing. Show how you hold how you work. Yeah, so she's doing that all the time. So she's holding her arm up like that all the time. Yeah. Tugevasti? And she can't hold that. Hoia Tugevasti? She can't hold it. Okay, so she's trying. So in a couple of minutes she's going to be able to. Now we're going to try this way. Hoia Tugevasti, Hoia. And she can't hold that one either. Let's try this side. Hoia Tugevasti, Hoia. And this one's actually a little bit weak as well. Okay, so now we're going to look at the other x-ray, and what's happening with her there is she's got a complete alargosis, loss of the normal curve, with osteoarthritic spurring starting to develop and discompression of C5-6. We can zoom in on that right now. We'll zoom in on it right here, and we can see that there's compression. If you look at the spacing here, look at the spacing back there, and you see the changes of the shape of the bone and the osteophytes that are starting to develop there. That's osteoarthritis. And degenerative disc disease that's starting in there. Definitely nerve compression going into the arm. We're going to do the Trigenics special procedure on her right now. Okay, we're going to start with the neck here on the right side. She's got a lot of tension in through here. This is going to be painful. Aga hinga sisse ja kui hinga vaja liikuda niimoodi. Okay, niimoodi, yeah. Okay. Okay. So hinga sisse, hinga vaja ja liikuda tugevasti. Ludvaks? Ludvaks? What we're doing now is overloading the Golgi tendon organs in the splenius capitis muscle up here, coming up from the spinuses up to the mastoid breathing, which are heavily contracted in her case. Again. Good. Now what we're going to do is we're going to do the upper trapezius. What she's going to do is she's going to start with her head this way, and she's going to turn her head to the left. Ludvaks? Ludvaks? Uuesti? Okay, so what we're going to do now is we're going to move these bones up and through here. We're going to open up some of these, some of where the bones are contracted. Uuesti. You're going to hear a noise now.
Natukene kuulen niisugust trõginat, see on normaalne. Hästi lõdvaks lasen.
Lõdvaks. Lõdvaks. Okay, now it's going to be, just push the face down. It's going to be painful, painful. Face straight down, straight down.
Otse niimoodi alla, põranda suunas, kaelast.
Uuesti. Lõdvaks, lõdvaks, lõdvaks. Oh boy, it's really, really stiff. Good. Okay. Okay, so now on that shoulder, I'm going to do the biceps and I'm going to do the subscapularis.
Yeah.
So you can look at the biceps on your screen. You can see the subscapularis on your screen as well. I'm using my leg as a resistance for this movement. All movements have to be resisted in order to get the mechanoreceptors stimulation maximized.
Oh.
There we go. Okay.
Oh.
Not fun, not fun. Okay. Istu. Hoya. Hoya. So, she's not breaking anymore. She's still a little bit weak, but she's not breaking because of pain. She was breaking because of pain before. Before she couldn't hold it, it would break. Now she can still hold it. I can fatigue the muscle, but she doesn't have the pain in there anymore. Hoya? Yeah. You see? And she's afraid to do it, but she can do it. You see?
On tugevam, et sa ennem nagu murdusid selles valus seal.
Okay, so now the deltoid, remember how weak that was. So what we're going to do now is we're going to strengthen that as well. Westy. Now I'm going to drop that humerus down. Here we go. So make sure you hold on to her. She might hear a little clunk. Maybe, maybe not. Hinge sisse. Valia. Tell her to drop it down. Let the arm relax. Let the arm relax.
See õlge hästi vabaks. Hästi vabaks. Vabalt lihtsalt kukkuda.
Westy. Okay, Hoya, tugevasti, Hoya. Start with 2 fingers, Hoya. Hoya, Hoya, ulest, 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 ulest. Now the whole hand. Hoya, ulest, Hoya, Hoya, Hoya. Hoya. There you go. This is a monomodal Trigenics. I'm using the triggerizers, the bilateral head triggerizers on this.
Oh.
Okay, that's done. Back and forth.
Oh. Kannata hinga.
Box. I'm just going to do a little bit of lengthening here on the flexors as well. Box. And strengthening on the extensors. Valia. Now we're going to see the difference here. Hold the hand now with the wrist up. Straighten the elbow. Wrist up. Hold it. Hold it hard. Hold it. Hoya, don't tell her not to worry. Just do it. Hoya, tugevasti.
Kõvasti. Näed vahet.
Ei
vajuda ka.
Not breaking. And now I'm just going to manipulate the elbow a little bit. Good. Just went into the joint there. Better. Okay, try it. Tell her to move it now. Do the same movement again now. Easier now. It's not going to be perfect. It's better. Better. Okay. It doesn't quite still, I know it's...
No,
it's better now. It goes straighter now.
Straighter, yeah. Very good feeling.
Very good feeling, yeah. That's good. To do that is good to do it.
Niimoodi on hea teha sellist harjutust.
Anyway, happier? Yes?
Õnnelikum.
Happier? Yeah? Yes? Okay. I have to make like this to the camera, like this. This is the Dr. O sign. Yeah. Good. So there you have it. There's a case of, wow, chronic static loading stress that she's had working day and night for 20 years as a hairdresser in Tallinn, Estonia, holding her hand and arm, working so many hours and so many days and so many clients that finally everything had become fibrotic and hardened and contracted in her neck. Her head had dropped forward, deterioration of the discs, causing compression of the nerves, getting a thoracic outlet syndrome, and finally also ramifications of that into where the nerves are going into the elbow on both sides, causing a lateral epicondylitis and medial epicondylitis, otherwise known as sort of golfers or tennis elbow type of situation. Extremely painful, terrible situation. But she's feeling much better today, and as you can see, and moving her head around and smiling, right? Yes. And yeah, it's another success story for Trigenics here from Tallinn, Estonia. This is Dr. O and the Dr. O Show. Thanks a lot for watching our Trigenics video today. Make sure that you subscribe to the Trigenics YouTube channel so that you're always sent information on the latest Trigenics techniques and methods, as well as the latest Trigenics success stories. This is Dr. O and the Dr. O Show.